And I'll put it to you this way. So everybody comes into our office, typically, will grab their behind and say, my hip is killing me. That is typically not ball and socket hip joint pain. But here's where a good diagnosis and being a good diagnostician, I think you would agree, is imperative, because that can be referred from the back, and oftentimes is, can be referred from the back of the hip joint, or what we call the sacroiliac joint, in where the tailbone comes together with the hip bone. And oftentimes that's kind of one of those diagnoses that it mimics back pain, it mimics sciatic pain, it mimics hip pain, but it's kind of can be a difficult diagnosis at times. And the treatment can be very effective through chiropractic treatment. So it's important to delineate. If it's hip pain, true ball and socket hip pain, most of the time it's going to be in the front of the hip, in the groin, in the thigh, and it's going to be reproducible with rotating the hip in and out. And that's not going to produce buttock pain so much as it is groin pain. And so and oftentimes obviously an x-ray can help delineate that as well.
And one thing I wanted to add to that, Dr. Weber, is that we have a group of muscles in our thighs, or the front part of our legs, called the hip flexors. They actually go through the pelvis and attach at the lumbar spine, which is the lower back. And a lot of times, if those muscles are overtaut or shortened or not being stretched properly, they can actually pull the pelvis forward, therefore creating an over what we call a lordosis curve in the lumbar spine, which can also create and reproduce lower back pain. So I think that as well could be added in there, and where chiropractic and manual stretching can be beneficial in understanding these types of diagnosis and treatments.